Welcome back, everybody. We're diving deep today into a study that's making some serious waves.
Yeah, it's a hot topic, that's for sure.
It's called Review. Calls for market removal of COVID-19 vaccines intensify as risks far outweigh theoretical benefits.
Catchy title.
Right. And it's from the McCullough Foundation, published in the journal Science, Public Health Policy, and the Law.
Okay, so right off the bat, we're dealing with some strong opinions here. This study is suggesting that COVID-19 vaccines should be pulled from the market, like right now.
That's certainly a bold statement. So let's break it down. What's the basis for this claim? What kind of evidence are they presenting?
Well, one of the first things they highlight is the sheer number of people and organizations who are raising concerns about the safety of these vaccines.
Okay, how many are we talking about?
They cite over 81,000 physicians and scientists, 240 government officials, and 17 professional organizations, among others.
Wow, that's a lot of people. I mean, you don't see that kind of pushback within the medical community every day. What do you think? Is this just a vocal minority, or is there something more to it?
It's definitely unusual to see that level of concern. I think it suggests we need to take a closer look at the evidence.
Agreed. So what are some of the key findings that are driving these calls for withdrawal?
One of the main things the study points to is data from the Vaccine Adverse Event Reporting System, VAERS.
Ah, VAERS. I know there's been some back and forth about how reliable that data is. Can you explain why?
Sure. So VAERS is a system where anyone can report a potential side effect they experienced after getting a vaccine.
Right, so it's self-reported.
Exactly.
Yeah.
And that means there's no guarantee that everything gets reported. Plus, just because something is reported doesn't mean it was definitely caused by the vaccine.
So how do we make sense of this data?
Well, the study acknowledges those limitations. However, they also point to a really significant number of deaths reported after COVID-19 vaccination. They cite 19,028 deaths in the U.S., where healthcare professionals or pharmaceutical companies suspected the vaccine as a factor.
Okay, that number definitely jumps out. But if we can't assume causation, how much weight can we really give that?
Right. So to try and account for potential underreporting in VAERS, the study uses a multiplier. They say the real number of deaths could be 31 times higher.
Hold on, 31 times higher. That puts us close to what? 600,000 deaths? Doesn't that seem a little speculative?
It's definitely a big number. The study argues that even if the real number is lower, the sheer volume of reports, especially those happening within days of vaccination, warrants further investigation.
Okay, so there are questions about the VAERS data and how it's being interpreted. What other evidence does the study present?
Well, they also look at trends in excess mortality, which is basically the number of deaths that are above what we normally expect to see. They cite 12 additional studies that suggest a possible link between COVID-19 vaccination and increased mortality, estimating a global death toll that could exceed 17 million.
17 million, that's a huge number. How solid is the evidence linking these deaths to the vaccines? Is there a clear cause and effect?
That's the key question, and it's one researchers are still trying to answer. The study says the timing of this increase in excess mortality happening alongside the vaccine rollout is suspicious, but it's not conclusive proof.
So there are these troubling stats, but it sounds like there's still a lot of uncertainty. What else does the study highlight to support its claim?
It actually compares the situation to past vaccine withdrawals, like the Qatar polio vaccine, the swine flu vaccine, and the Rotoshield vaccine.
Interesting. And those were all withdrawn for safety concerns.
Exactly, after a much smaller number of reported deaths or adverse events than what we're seeing with the COVID-19 vaccines.
So they're saying that if those vaccines were pulled based on a handful of cases, the current situation should warrant similar action.
Basically, yeah. They also emphasize that the total number of reported deaths linked to COVID-19 vaccines in VAERS globally, 37,544, far exceeds the numbers that led to those previous withdrawals.
Okay, so they're building a case based on historical precedent. What about the effectiveness of these vaccines? Weren't they supposed to prevent infection and serious illness?
Yeah, that was the initial idea. But the study cites a number of studies that suggest vaccinated individuals might actually be at a higher risk of COVID-19 infection compared to unvaccinated people.
Wait, seriously, higher risk. Can you give me an example?
Sure. One study they cite found that vaccinated individuals had a 42% higher risk of reinfection. Another found that the effectiveness of the Pfizer and Moderna vaccines against Omicron subvariants actually went negative after 7 months.
Negative effectiveness? What does that even mean?
It means that after a certain point, Vaccinated people were more likely to get infected with those variants than unvaccinated people. The study suggests this could be because of something called immune imprinting, where the initial vaccine dose might actually make the immune system less effective against newer variants.
Okay, so we've got potential safety concerns, questions about long-term efficacy, and now the study throws another curveball, DNA contamination.
Right. This is another area where the study raises a red flag. They point to widespread DNA contamination in COVID-19 vaccines exceeding the recommended safety thresholds. And this contamination has been reported across multiple manufacturers, vaccine platforms, and different parts of the world.
So it's not just an isolated incident.
No, they're saying it's a systemic problem.
What kind of DNA are we talking about here, and why is it a concern?
The study doesn't get into the specifics of where the DNA is coming from, but they emphasize that any level of contamination beyond what's considered safe is a risk. The worry is that this foreign genetic material could have unintended consequences, maybe disrupting cellular processes or even contributing to cancer or autoimmune diseases down the line.
This is a lot to take in. Potential safety issues, questions about how well they work, and now DNA contamination. What's the bottom line? What does the study conclude based on all of this?
Well, they come right out and say it. The evidence for excess mortality, negative efficacy, and DNA contamination warrants immediately removing COVID-19 vaccines from the market. They even go so far as to say that continuing to administer these vaccines goes against good medical practice and the Hippocratic Oath.
Wow, they're not holding back.
Nope. They're definitely taking a strong stance. And I think it's safe to say it's going to generate a lot of debate. But we need to remember this study is just one piece of a very big puzzle. It's important to note that this study and the McCullough Foundation itself has gotten some pushback from mainstream medical and scientific institutions.
Yeah, I've seen that. Headlines calling them, what was it, anti-vaccine, accusing them of spreading misinformation. It can get pretty heated.
Yeah.
How do we sort through all that? Is this just healthy scientific debate, or is there something else going on here?
Well, there are definitely strong opinions on both sides of this issue, which, happens in science. You challenge the status quo, push the boundaries of knowledge.
Right.
But the debate around COVID-19 vaccines has been especially intense, and it can be really hard to separate fact from fiction.
So let's try to do that. What are some of the main criticisms of the study and the McCullough Foundation?
One of the big ones is that they rely so heavily on that VAERS data, which, like we talked about, has limitations.
Right.
Critics say they might be reading too much into that data and jumping to conclusions that the evidence doesn't fully support.
But didn't they try to adjust for that with the underreporting multiplier?
Yeah, they did. But critics argue that even with that, the estimated death toll could still be way too high. They point out that literally anyone can report anything to VAERS, and there's no real way to check if all those reports are accurate.
Okay, so the VAERS data is a point of contention. What about the excess mortality data? Are there other possible reasons for the increase in deaths besides the vaccines?
Oh, absolutely. Critics point to all sorts of things that could contribute to excess mortality, including the pandemic itself. I mean, the virus caused a ton of deaths directly, and there were indirect impacts too, like delayed healthcare because of lockdowns or the long-term effects of COVID-19.
Right, right.
They argue that blaming excess mortality solely on the vaccines is just premature. We need more research that takes all those variables into account.
That makes sense. It's complicated. Lots of factors. What about those studies that the paper cites, the ones showing negative efficacy? What do critics say about those?
They say those studies are often misinterpreted or taken out of context. They point out that a lot of them are preprints, which means they haven't been peer-reviewed yet or officially published in reputable journals.
Okay.
And they say some of them have problems with their methodology, or they're based on small sample sizes, so the findings might not be super reliable.
So basically they're saying don't jump to conclusions based on research that hasn't been fully vetted. But isn't that a little dismissive? Shouldn't we at least consider the possibility that these studies might be onto something, even if the research isn't rock solid yet?
Yeah, that's a fair point.
Yeah.
It's crucial to keep an open mind and not just shut down evidence because it goes against the mainstream narrative. Science is all about questioning and pushing the boundaries. But at the same time, we have to be smart about how we interpret scientific research, understand its limitations, and be cautious about drawing big conclusions from studies that haven't been thoroughly checked by the scientific community.
Speaking of the scientific community, the big players like the CDC, WHO, and FDA all seem pretty unified in their stance that the COVID-19 vaccines are safe and effective. They're still recommending them, despite this study's concerns. How do they square that circle?
They do acknowledge that vaccines can have side effects, just like any medical intervention, but they maintain that serious problems are very rare and that most people only experience mild temporary side effects. They say their recommendations are based on a huge amount of data, from clinical trials, real-world observations, and ongoing safety monitoring.
But what about the specific issues this study brings up, like the VAERS reports, the excess mortality data? Do they just ignore those?
Not exactly. They usually offer alternative explanations for that data, like the factors we talked about earlier, that could also contribute to excess mortality. And they emphasize the benefits of vaccination, like preventing severe illness, hospitalization, and death from COVID-19.
Okay, so we've got these two sides. The McCullough Foundation saying there are serious risks, and mainstream health organizations saying the benefits outweigh the risks. It's confusing. How are people supposed to make informed decisions with all this conflicting information flying around?
That's the challenge, isn't it? And unfortunately, there's no simple answer. It really comes down to critical thinking, to carefully evaluating the sources and engaging with different perspectives. Don't just accept what you hear, whether it's from the McCullough Foundation, the CDC, or anyone else.
Right.
Look at the evidence, be aware of potential biases, and come to your own conclusions based on a balanced view of the information.
Easier said than done. It seems like every day we're bombarded with new information, and it's hard to know who to trust.
It is. But the more we know, the better equipped we are to make those tough decisions. We can learn to think critically and become more discerning about where we get our information from.
Okay, so how do we do that? What are some practical steps to become more informed on these complex issues?
Well, one thing you can do is diversify your information sources. Don't just rely on mainstream media or social media. Seek out information from independent researchers, scientists, and journalists who are willing to question the status quo.
Right. Get out of the echo chamber.
Exactly. And be critical of the information you come across. Ask questions like, who funded this research? What might the author's biases be? Are there other ways to interpret the data?
So think critically, get different viewpoints. Anything else?
Don't shy away from tough conversations. Talk to people who have different opinions than you. Listen to their side of the story, even if you disagree.
It can be hard.
It can be. But you might learn something new, and it can help you better understand your own position.
I think that's so important. It's easy to just dismiss people who disagree with us, but that doesn't really get us anywhere.
Right. At the end of the day, this is about our right to make informed decisions about our own bodies and health. And to do that, we need accurate, unbiased information and the ability to think critically about that information.
Well said. This has been really helpful in understanding the complexities around this study and the whole debate about COVID-19 vaccines. But there's one thing I still want to talk about, that DNA contamination issue. I have to admit, that's the part that really makes me nervous. It sounds straight out of science fiction.
It is a bit unsettling, and it's something that definitely needs more research. The big question is, what are the long-term effects of injecting foreign DNA into the body? Do we know enough to answer that?
That's what worries me.
Yeah.
We could be talking about introducing genetic material with unknown consequences. Are the companies doing anything to address this? Are they working on cleaning up their vaccines?
That's a question for the regulatory agencies and the manufacturers themselves. Transparency is crucial here. The public has a right to know what's being done to ensure the safety and purity of these vaccines.
Okay, so we've talked about the study, the criticisms, the importance of critical thinking. But there's another piece of this puzzle that we can't ignore, the politics of it all. Because let's be real, this issue has become incredibly politicized.
Yeah, there's no denying that. The pandemic, and especially the vaccines, have gotten tangled up in political ideologies. It's almost impossible to have a conversation about vaccines without it turning into a political fight.
It's like people are choosing sides based on their political party rather than actually understanding the science. You're either pro-vaccine or anti-vaccine, and there's no in-between.
It's such a harmful oversimplification.
Yeah.
It stops us from having a real discussion about these complicated issues. When we reduce it to us versus them, we lose sight of the shared goal, protecting public health and making sure everyone in our society is healthy and safe.
And it's putting people's health at risk. When politics are dictating our healthcare decisions, we're not choosing what's best for ourselves or our families. We're choosing based on ideology, and that can have serious consequences.
Absolutely. We have to separate the science from the politics. We need to get back to a place where we can have rational, evidence-based conversations about vaccines without the distortion of political polarization.
So how do we do that? How do we depoliticize this issue? Get back to those productive, evidence-based conversations.
It's tough, but I think it starts with recognizing our own biases.
Yeah.
We all come to these conversations with pre-existing beliefs, and it's important to be aware of how those might be coloring our views.
Okay, self-awareness is key. What else?
Be willing to listen to and engage with people who think differently than you. You don't have to agree with them, but you should respect their right to have an opinion and understand their reasoning.
And be open to the possibility that you might be wrong, or at least that your understanding is incomplete.
Exactly. None of us have all the answers, especially with something as complex and ever-changing as this. We need to be humble and admit that there's a lot we still don't know.
Good point. Humility, curiosity, and a willingness to have good faith discussions seem crucial here. So we've talked about the study, the criticisms, the political mess, and the importance of critical thinking, but I think we're missing something crucial, the human element.
That's an important point. Behind all the statistics and scientific debates, there are real people whose lives have been affected by these vaccines, in both good and bad ways.
Exactly. This isn't just some intellectual exercise. We're talking about real lives, real consequences, and those individual experiences deserve to be heard.
Those personal stories can give us insights that we might miss if we only focus on the data. They remind us that this isn't just about numbers, it's about people's health and well-being.
You know, sometimes I think we get so focused on the big picture, the pandemic, the research, that we forget about the individual stories, the human cost of this whole thing. We need to hear from those who've had bad reactions, from those who believe the vaccine saved them, from the healthcare workers on the front lines, from parents trying to make the best decisions for their kids.
Absolutely. Those voices are vital. They add depth and nuance that we miss in abstract debates about science and policy. Their experiences help us understand the real-world impact of these decisions, beyond the statistics and jargon.
And it's not just about sharing those stories, it's about really listening to them with empathy and compassion. We need to create a space where people feel safe to share without being judged or silenced.
That's how you build trust and have a more productive conversation. When we shut down dissenting voices or dismiss personal experiences, we create fear and mistrust. We have to remember that everyone is entitled to their own experience, their own perspective. We might not agree with everyone, but we should create an environment where those views can be expressed freely.
And that means changing how we think. We need to move away from us versus them, that black and white thinking that divides people. We need to recognize that we're all human, that we all want to navigate this and find solutions that work for everyone.
Exactly. We need to be humble and admit that we don't have all the answers. We're all learning and adapting as we go, and it's okay to say, I don't know.
That's a good point. Humility is often seen as a weakness, but it's really a strength. It lets us be open to new information, to change our minds when we see convincing evidence, and to work together to find solutions that work for everyone.
I couldn't agree more. Science is a process of constant discovery. We need to be open to new information and willing to adjust our understanding as the evidence changes.
And that means admitting when we were wrong. We're all human, we make mistakes. It's how we react to those mistakes that matters.
Mistakes happen, especially with a new and rapidly changing virus like COVID-19. The important thing is to learn from them, be transparent, and hold ourselves and our leaders accountable.
And hold those in power accountable. Because at the end of the day, this is about more than just vaccines. It's about trust. Trust in our institutions, our healthcare system, our government. And once that trust is broken, it's incredibly hard to rebuild.
Exactly. When we lose faith in the systems that are meant to protect us, it affects everything. It creates fear, uncertainty, and division. And that makes it even harder to tackle the challenges we face, like a global pandemic.
So where do we go from here? What's the path forward in this confusing and often divisive landscape?
I think we have to acknowledge how complex this is. There are no easy answers, no one solution that works for everybody.
Okay, complexity, not oversimplification. What else can we do to move forward in a constructive way?
We need to focus on having open and honest conversations, even when they're hard. We need to listen to each other, respect different perspectives, and be open to changing our minds when presented with new evidence.
And we need to hold our leaders accountable for making decisions that are based on science, not politics. We need transparency, integrity, and a genuine commitment to putting public health first.
Exactly. We deserve leaders who care about the well-being of everyone. who are willing to listen to diverse viewpoints and make decisions based on the best scientific evidence, not on ideology or what's politically convenient.
That's a tall order, but I think it's possible if we work together, if we can bridge the gaps between us, listen with empathy, and have genuine dialogue. I think we can create a better future for ourselves and future generations.
I agree. It will take effort, patience, and a willingness to step outside of our comfort zones. But the stakes are too high to give up on finding common ground.
Well said. And on that note of, I guess, cautious optimism, we'll wrap up this part of our deep dive. It's been a challenging but important conversation, and I hope it's given our listeners a lot to think about. But before we go, I want to circle back to something we discussed, those personal stories that often get lost in the bigger picture. We want to hear from you, our listeners. If you have a personal experience related to COVID-19 vaccines that you'd like to share, please reach out to us. We're creating a platform for those stories without judgment or censorship.
Your stories are important. They help us understand the human side of this crisis, and they remind us that we're in this together. So if you're comfortable sharing, we're here to listen.
We'll be back next week with another deep dive into a different hot topic. Until then, stay curious, stay informed, and stay healthy. And remember, knowledge is power. And in a world where information is often used as a weapon, the ability to think critically for yourself is more important than ever. We've really gone in depth on this deep dive, haven't we? The study's claims, the pushback, the political side of it all. It's complicated, to say the least.
Definitely a lot of layers to unpack.
For sure. So as we wrap things up, I keep coming back to this question. What do we do with all this information?
It's the big one, right? It's easy to get overwhelmed. It's like paralyzed. So much info, so many different opinions, so much we just don't know for sure.
Absolutely. So how do we move forward? And how do we do it in a way that makes us feel empowered, not helpless?
I think first we have to accept that we don't need to have all the answers right this second. It's okay to be a little uncomfortable with not knowing everything, to admit there are things we're still figuring out, and things are always changing.
So embrace the uncertainty, the gray areas. Instead of trying to make everything black and white.
Exactly. This isn't simple. It's multifaceted. And what we understand today might change tomorrow as new information comes to light.
I hear you. But how do we avoid getting stuck? Overthinking everything to the point where we can't make any decisions. How do we actually make choices when things are this complex?
It's a balance, right? Between staying informed and also trusting your own judgment. We can't just ignore the info out there, but we also can't let fear and doubt take over to the point where we can't make decisions that feel right for us.
So it's about informed intuition, not blindly following the crowd or giving into fear.
Yes, exactly. Take in the information, analyze it critically, and then make the choice that aligns with your values and priorities. And remember, there's no such thing as a completely risk-free option.
And understanding that those decisions might change as the situation evolves or we learn something new.
Absolutely. Things are constantly shifting. What seemed right a year ago might not seem right now. And that's okay. It just means we're learning and adapting.
Flexibility and adaptability are key. But also remembering that we're not in this alone. Everyone's going through this uncertainty together.
Such an important point.
Yeah.
It's easy to feel isolated with these big challenges, but we're part of a community. We can support each other and find strength in that.
And learn from each other, too. Good experiences, bad experiences, it all adds to our collective understanding.
Right. It's like this giant experiment we're all part of. And by sharing our experiences and perspectives, we can help each other navigate it all and make better decisions.
And when it comes down to it, isn't that the whole point? Empowering ourselves and each other with knowledge and understanding, giving people the ability to make choices that feel true to them.
That's it perfectly. It's about taking back control in a world that can feel so chaotic and unpredictable. It's about recognizing that we do have the power to make informed choices, to speak up for ourselves and our loved ones, and to work towards a future that's healthier, fairer, and more just for everyone.
I love that. It's a great reminder that even when things feel uncertain, we're not powerless. We can make a difference.
Exactly. We might not have every single answer, but we have courage, resilience, and the ability to figure things out together.
Beautifully said. And on that note, I think it's time to wrap up this deep dive. It's been challenging, but so important. I hope it's given our listeners a lot to consider.
It's been a pleasure diving into this with you.
Likewise. And to everyone listening, thank you for being part of this conversation. Stay curious, stay informed, and stay well. And always remember, knowledge is power. Especially in a world where information can be twisted and manipulated, the ability to think critically for yourself is more valuable than ever.